Packaging. The CK Surgitech multi-stage balloon comes packaged sterile, 1 per box. The box and packaging label includes the order number, product size and specifications, date of manufacture and use by date. The multi-stage balloon has a 3-year shelf life. Tracking stickers are located on the plastic peel pouch. Preparing the device. Each balloon comes packaged in a plastic peel pouch. It is important to check the device for damage and ensure the packaging is intact prior to its use. Open the pouch and carefully remove the device from the packaging. Remove the paper tag to uncoil. Caution: do not pre-inflate or test the balloon prior to insertion. Performing the procedure. Firstly, you need to prepare your syringe inflator. The CK Surgitech syringe inflator comes packaged sterile, 1 per box. The box and packaging label includes the order number, product size and specifications, date of manufacture and use by date. The syringe inflator has a 3-year shelf life. Tracking stickers are located on the packaging. It is important to check the device for damage and ensure the packaging is intact prior to its use. Carefully remove the inflation device from its packaging. Use the syringe inflator to drop 35 ml of sterile water. 35 ml is marked on the syringe by a red arrow. Please note, the packaging can be used as a water container. To draw up, squeeze the lever and pull the plunger toward you. Remember to prime the inflation device. This is achieved by squeezing the lever and pushing the plunger forward. Ensure the syringe remains filled to 35 ml. Attach the primed inflation device to the balloon catheter port. The balloon has 2 ports that can be identified as guide wire and balloon. The guide wire assists with catheter insertion and provides the option of guide wire assisted dilatation. A 3-way tap has been provided. It is up to the individual if they choose to use this, but it is not necessary for the procedure. The 3-way tap is useful when you need to add sterile water to the inflation syringe and/or to expel water or air. Remove the plastic sheath from the distal end of the balloon. The device is now ready to be inserted down the biopsy channel. Insertion tips. If required, you can open the biopsy valve to assist with catheter insertion, or use a plastic sheath to puncture the biopsy cap. The plastic sheath can also assist with catheter insertion. Short, deliberate movements are required to safely pass the catheter down the channel of the scope. Ensure the balloon catheter is clearly visible before inflation. Once the balloon's position is confirmed, it is now time to inflate the balloon using the inflation device. Caution: do not use air or gas to inflate the balloon. When instructed by the doctor, squeeze a lever and push the plunger forward to inflate the balloon. Make sure the syringe is facing downwards to make inflation quicker. Release the lever once you have injected fluid into the balloon. The multi-stage balloon can attain 3 different sizes at the associated inflation pressures. Adjust the pressure of the balloon by winding the wheel of the syringe clockwise, referring to the pressure diameter tag label near the hub on the proximal end of the catheter. Caution: the balloon may burst if excessive pressure is applied. Carefully observe the balloon pressure during dilation. It is normal to make minor adjustments as needed to maintain pressure. This is achieved by turning the inflation wheel clockwise. Alternatively, you may wind the wheel anti-clockwise to deflate the balloon to a smaller size. The balloon can be inflated and deflated as many times as required during the procedure. If required, the guide wire can be advanced to assist with other strictures during the procedure. The position of the balloon can be achieved or verified through fluoroscopy with the help of radiopaque markers. To remove the catheter, you firstly need to deflate the balloon. This is done by applying negative pressure with the inflation device. To deflate the balloon quickly, squeeze the lever and pull down firmly on the syringe while facing it upwards until you pass the 35 ml marker, the red arrow. Release the lever. Water will continue to drain into the syringe without applying excessive force. Ensure all liquid is withdrawn from the balloon before slowly removing the catheter from the endoscope. Caution: if the water has not been withdrawn from the balloon prior to the catheter being pulled back up through the working channel, it can get stuck at the distal end of the scope. If this is the case, remove the endoscope with the balloon catheter inside. You will then need to extend the catheter out of the distal end of the scope and cut the sheath at the join of the balloon and sheath. If you do not have wire cutters, pull the guide wire back so that it is not evident in the balloon, and then you can cut the sheath with scissors. Once the catheter has been removed from the endoscope, discard the inflation device and balloon catheter as per your facility's infection control policies and guidelines.